Welcome back everyone to Rapid Case Challenges Pharmacology. I'm your host, Pharmacist Tyson, and let's get going with our first case here. So JT is a 60-year-old man who recently visited his primary care provider for a follow-up. His medical history includes hypothyroidism, hypertension, and type 2 diabetes. He takes levothyroxine 100 micrograms daily, metoprolol succinate 100 milligrams twice daily, lisinopril 20 milligrams daily, and metformin 1000 milligrams twice daily. His primary care physician started JT on oral glimepiride 4 milligrams once daily for his uncontrolled type 2 diabetes. After a week, JT has noticed increased irritability, confusion, and excessive shakiness, and sweating since starting the new medication. What may have caused these adverse effects? Wow, so we got a lot of information here, but at the same time we don't have much about our patient here. We know his past medical history, but we do not know any labs. We do not know an A1C. We don't know a glucose level. This is just surface level knowledge and information that the patient can give you. So first thing that we do is we look at the age and the gender of the patient, 60-year-old man. So we know that he's a little bit older and he's a man. So medications affect his body a little bit different than others. We know that levothyroxine is being used for the hypothyroidism, the metoprolol is being used for the hypertension, lisinopril is being used for the hypertension, metformin is being used for the type 2 diabetes. Okay, it looks like his medications are good. Now, looks like the doctor is adding a glimepiride 4 milligram, which is an anti-diabetic medication for his uncontrolled diabetes. So it looks like with just the metformin, it's not cutting it. So that's all we know at this point. But now we look at the main chief complaint. He's noticed increased irritability, confusion, and excessive shaking, sweating since starting the new medication. What may be causing these adverse effects? Well, the only thing that has changed from his past medical history is starting a new medication. So our crucial red flag today is that the patient is experiencing hypoglycemia, which is an adverse effect of glimepiride. His blood sugars are getting too low. Irritability, confusion, and excessive shaking and sweating are all signs of hypoglycemia. Another red flag that we should notice is that hypoglycemia from glimepiride is more severe in older adults. So as we mentioned earlier, he is a little bit older. This one is a red flag, but at the same time it happens all the time. The glimepiride dose that he was started on was a little too high. He should have been started on 1 to 2 milligrams a day and then titrated up depending on how well he handles it. So start low and go slow. Start with the 1 milligram, see how his blood sugars does, and you can increase it, titrate it up that way. Red flag number 3, tachycardia is a common sign of hypoglycemia. The patient did not present with this due to the patient is taking a heart rate medication, the metoprolol, which controls the heart rate, so you don't get that tachycardia. Now, speaking of metoprolol, the succinate is the extended release and typically is dosed only once a day. It can be dosed twice a day, but that is not how it was intended to be given. Just a small red flag there, something to bring up to the provider's attention if that was ever causing a problem. Metoprolol also causes dizziness and fatigue, which could have augmented the adverse effects of the glimepiride. However, the dizziness and fatigue usually only lasts about the first week to 2 weeks of starting the metoprolol medication. However, since we did start a new medication, it could have reset all of those and the body could be experiencing some of that dizziness and fatigue from the metoprolol augmented by the glimepiride. Some advice for this patient, definitely check the blood sugar. If we are below the 80 milligrams per deciliter, we need to be given a little bit of glucose and tell them to follow up with a provider. Keep simple glucose, which is simple sugars, candy, glucose tablets. Juice is a really good one, and that just raises your blood sugar really fast, but if you overdo it, then you're going to overshoot the mark. So we definitely need to follow up with the primary care provider. Normal blood sugar levels, 100 to 140, and that is a non-fasting. So say you check your blood sugar after you ate, it should be about a 100 to 140, right in there. If it is too low and causing hypoglycemia, it could be due to the medication. If it's high, your blood sugars are not controlled. So as a pharmacist, we can use clinical judgment to advise stopping or not stopping the glimepiride until they can talk to a primary care provider. The reason why we can do that is because we don't want them to go home, take more of the glimepiride, or accidentally double up on it, which has happened many times in my experience, and they just go into a very severe hypoglycemia state to the point where they need to go to the emergency room. That's what we're here for, is to recognize these adverse effects, recognize these red flags, so that we can protect our patients in every aspect possible. Thank you so much for listening to our case here. If you have any questions, please reach out. Please visit us on rapidcasechallenges.com. Follow us on Instagram and Facebook. This is your host, Pharmacist Tyson, and please, if you have any questions about this case, reach out. I'm more than happy to talk with you and talk through some different scenarios also. Thank you and have a wonderful day.